Welcome to KLR Medical Certification Training School, where we're all about building skills, careers, and futures. Today, we will be reviewing the donning and doffing procedures of PPE for infection control in healthcare. While this skill is a requirement for our medical assistants to learn, this skill can also be applied across healthcare professions, from nursing to emergency room technicians. So, what is PPE? PPE stands for Personal Protective Equipment. This includes gloves, face masks, gowns, hairnets, hand sanitizer, and more. PPE helps healthcare professionals avoid contamination, exposure to harmful pathogens, and it is disposable, so they can be thrown away after use. Donning refers to putting on your PPE in a specific order, and doffing is taking it off. Ms. Grisham and I will walk you through the steps for donning and doffing your PPE.
First, make sure you have all your PPE in one place to make donning efficient and to make sure you have everything you need in arm's reach. Step 1. Put on booties. This step is optional and often used in more hazardous environments where exposure to pathogens is more likely to occur. While seated, place booties over closed-toed shoes. Step 2. Perform hand hygiene. The CDC recommends washing your hands with soap and water for at least 20 seconds. For this demonstration, Ms. Freeman is using 60% alcohol hand sanitizer, which is also recommended best practice for hands that are not visibly soiled. Step 3. Put on your gown. The gown has two areas to fasten it to your body, one at the waist and one around your neck. Step 4. Put on your hairnet. This makes sure no loose hairs get in your way or on the floor. It is also an extra layer of protection for exposure to germs. Place the hairnet over your ears to get the most protection. Step 5. Put on a face mask. In more high-severity environments, N95 face masks with ventilators are used to reduce exposure.
And lastly, let's put on gloves.
Once you have donned all your PPE properly, you are ready to head into the area where the PPE was needed. This could be into a patient's room, a designated infectious isolation area, an emergency care room, or anywhere there is potential for exposure to infectious diseases. Now, let's review the doffing procedure. Doffing is done once you leave the isolation rooms or other infectious areas. Step 1. Remove your gloves. Safely dispose of your gloves in a biohazard container. Step 2. Remove your gown. Carefully untie the strings at your neck and waist. Remove your arms and use the ends of the arms to start rolling the contaminated gown into a ball, avoiding touching the outside that was exposed to the surrounding area. Step 3. Remove your face mask. Grab the elastic behind your ears and avoid touching the contaminated side of your mask. Dispose of the face mask in the biohazard container. Step 4. Remove your hairnet. Again, avoid touching the outside of the net and your face by putting your fingers under the hairnet by your ear and peeling the net off your head. Properly dispose of the hairnet. Step 5. Sit down and don a fresh pair of gloves. Pull off the contaminated booties. Properly dispose of the booties and then remove the gloves and throw them away. Step 6. Perform hand hygiene. In a normal clinical setting, this would be done with soap and water at a sink. For this demonstration, we are using 60% alcohol sanitizer.
Hand hygiene should occur throughout the donning and doffing process. You will often perform hand hygiene whenever your ungloved hands touch something that has a contaminated side. For example, you would wash your hands before donning gloves, even though you also cleaned your hands after donning booties. Some situations call for performing hand hygiene right after doffing your gloves. Best practice is to use PPE based on the assessed potential hazards in the environment. If you are heading into an isolation room with someone who is very sick, you may need more PPE than your standard gloves for physical exams and handling bodily fluids. And remember, using PPE appropriately helps you and your patients stay safe from the spread of infections. Thank you for joining us today. If you found this video helpful, don't forget to like, subscribe, and share it with someone who could benefit. Stay motivated, keep learning, and remember, you can do hard things. We will see you in the next video.